Assalamualaikum and hi, I am Farah, and this video we will be explaining regarding magnetic resonance imaging (MRI). MRI is a non-ionizing type of radiation of imaging examination, and it is very useful for soft tissue viewing. It mainly uses hydrogen protons because it is the most abundant element in human body found in water and fat molecules. Other than that, it is due to its single proton that gives large magnetic moment, meaning that it has strong reaction to magnetic field, producing clear signal for imaging. When a patient enters the strong static magnetic field B0 of an MRI scanner, the hydrogen protons in their body undergo three specific changes. The first one would be alignment. Normally, protons are randomly oriented in human body, while inside the scanner, the strong magnetic field causes the magnetic moment of the protons to align with the field. They align in two energy states. The first one is parallel, which is the low energy aligned with the B0, and the next one is anti-parallel, high energy opposite the B0. The parallel state is the naturally preferred state, resulting in a net magnetic factor NMV aligned with the main magnetic field. Once aligned, the proton do not just sit still. They wobble around the axis of the magnetic field. This wobbling motion is called precession. The speed of this wobble is the precessional frequency, which is determined by the strength of the magnetic field. The stronger the magnet, the faster the precession. This relationship is governed by the Lamont equation. To get a signal, the MRI system transmits a radio frequency pulse that matches the precessional frequency, which is the Lamont frequency of the hydrogen protons. The protons absorb this energy, a phenomenon called resonance. When RF pulse is turned off, they will return back to original state through T1 and T2 relaxation. Difference between T1 and T2 relaxation time provide contrast between tissues. This energy absorption causes the protons to be in higher energy state and causes the net magnetic vector NMV to flee away from the longitudinal plane, usually 90 degrees into the transverse plane. It also causes the protons to move in phase, which is coherent, spinning together in synchronization. Now I will be moving on to basic components of MRI system. The most important part is the layer of MRI coils. It consists of 4 layers. The first one is magnet coil. It is the most outer layer of the scanner and functions to create a uniform and stable B0. The importance of keeping B0 stable is to determine Lamont frequency and maintain image quality. The next layer is shim coil. It is the second inner layer of scanner and functions to improve the homogeneity of B0. B0 homogeneity is crucial for field uniformity, improve image quality, and to ensure accuracy in advanced MRI techniques. The third inner layer is gradient coil. Functions of the coil is to locate origin of MRI signal and create spatial variation in B0. And the last one is RF coil. It is the innermost layer and function to transmit and receive radio frequency signal. It has few types such as transmit only, receive only, and transmit-receive coils. It also comes with few designs such as body coil and surface coil. RF transmitter and receiver system is to generate RF pulse and amplify weak signal. Next is computer system that control path sequence and gradient. It will convert the raw data obtained into display image and store it. Other than that, the MRI cryogenic system. Cryogen is to absorb heat and maintain cryogenic temperature in system. Liquid helium is used to keep the superconducting magnet at 4.2 Kelvin, which is the low boiling point for it to be able to generate strong and stable B0 without electrical resistance. While cryostat is a vacuum-insulated chamber that houses and maintains cryogen at low temperature. It is used to prevent heat transfer from environment and maintaining low temperature required for the coils. Lastly is the main magnet. The most commonly used is superconducting magnets such as niobium titanium. It has stronger magnetic field and zero resistance when cooled with liquid helium at 4.2 Kelvin. Resistive magnets such as aluminium wire cord require constant electrical current to generate magnetic field, and it will stop generate when overheat. The last one is permanent magnet made of ferromagnetic and generates static magnetic field without power or cooling.
Okay, so now I'll explain about the image acquisition of the MRI. MRI image acquisitions begins after the patient is positioned inside a strong magnetic field. These magnetic fields will align the hydrogen protons in the body. MRI does not create images directly like X-ray or CT. Instead, it works by detecting signals from hydrogen protons, which are abundant in body tissues. And then the radio frequency or RF pulses are then applied to excite the protons and move them out of the alignment. When the protons return to their original state, they will emit signals. These emitted signals are detected by receiver coils placed around the area being scanned. At this stage, the signals do not form an image yet. They are stored as raw data known as K-space data, which will later be processed to reconstruct the final MRI image. And then the data collected will be processed into a visible image. During signal processing, the RF pulses cause the hydrogen protons to absorb energy and lose their alignment with the magnetic field. When the RF pulse is switched off, the protons will relax back to their original position and emit RF signals. These signals contain spatial frequency information which is stored in K-space. An inverse Fourier transform is then applied to convert the K-space data into a visible image. Parameters such as repetition time or TR and echo time or TE are adjusted to control the image contrast. Finally, the reconstructed images display anatomical structures in 2D or 3D form. Okay, now I will explain about some of the clinical applications of the MRI. So firstly, in neurological imaging, MRI is used to diagnose conditions such as brain tumors, stroke, and multiple sclerosis. Its excellent soft tissue contrast allows clear differentiation between normal and abnormal brain tissue. Techniques such as diffusion-weighted imaging enable early detections of acute stroke, while contrast-enhanced MRI helps in accurate tumor detections and localizations. Besides neurological, MRI also helps in musculoskeletal imaging. MRI is highly effective in diagnosing ligament and tendon tears, joint injuries, and also muscle abnormalities. MRI clearly visualizes soft tissue such as cartilage, ligaments, and muscles. It can also detect inflammations, edema, and also internal joint damage. MRI usually useful in assessing injury severity and helps doctors to planning treatment for patients. While in cardiovascular imaging, MRI is used to evaluate heart anatomy and also its functions. It helps diagnose cardiomyopathy, congenital heart disease, and also myocardial damage. This can be done by MRI assess cardiac structure, its functions, and also blood flow. MRI can also detect myocardial scarring after infarctions using late gadolinium enhancements. It helps evaluate heart motions and also ventricular functions. In oncology, MRI is used for tumor detection, staging, and follow-up due to its excellent soft tissue contrast. It helps determine the size, location, and extent of tumor spread. MRI is also used to assess tumor response to treatment by comparing changes in tumor size and tissue characteristics over time. Additionally, whole body MRI is also used for metastasis screening, allowing detections of cancer spread without the use of ionizing radiations. Lastly, MRI is widely used in abdominal and pelvic imaging. This is due to its excellent soft tissue contrast. It helps detect lesions in organs such as the liver, pancreas, and also kidneys. MRI is also useful in diagnosing uterine fibroids and ovarian pathologies, as well as detecting prostate cancer with high accuracy. In addition, MRI also can be used to visualize the biliary and pancreatic ducts through MRCP. allowing non-invasive assessment of ductal abnormalities. That's all from me. Thank you.
Assalamualaikum, I am MIT310 and I will be explaining about the next content. This slide discusses the latest technology used in MRI that aim to improve the image quality, patient comfort, and operational efficacy. Firstly, high-beam MRI systems have been developed to challenge the idea that higher magnetic field strength always produces better images. These systems help reduce metal artifacts and susceptibility issues which commonly occur near implants or air tissues interfaces. As a result, high-beam MRI improves image clarity and expands the clinical applications of MRI, especially in patients with implants. Secondly, reduced helium or helium-free MRI designs address the issue of helium shortage and high maintenance costs. These systems use sealed magnets and advanced cooling technology to maintain superconductivity with minimal helium loss. This not only reduces operational costs but also improves sustainability and safety within MRI facilities. Lastly, larger bore MRI scanners have been introduced to enhance patient comfort. A wider bore is particularly beneficial for bariatric patients, children, and patients who experience claustrophobia. By reducing the anxiety and discomfort of the patient, larger bore scanners also help minimize patient movement, which helps improve the image quality. Overall, these latest MRI technologies focus on achieving high-quality imaging while also improving the patient's experience and workflow efficiency. Firstly, MRI does not use ionizing radiation, which makes it safer for the patient. Secondly, MRI provides excellent soft tissue contrast, allowing clear visualization of organs, muscles, and the nervous system. Next, MRI is able to detect a wide variety of pathological conditions such as tumor, inflammations, or neurological disorders. In addition, MRI can also be useful without contrast agents, which reduces the risk for patients with allergies or kidney disease. Lastly, MRI offers multi-planar imaging, meaning that images can be obtained in different planes without repositioning the patient. Overall, these advantages makes MRI a very valuable imaging modality in clinical practice. However, there are also limitations of MRI. Firstly, MRI is expensive. The machines are costly to purchase and maintain, and operational expenses are high. This can make MRI less accessible in some hospitals or clinics. Secondly, MRI takes longer than other imaging methods like CT scan. A typical scan can last anywhere from 30 to 90 minutes depending on the area being examined. This can be challenging for patients who are in pain, anxious, or unable to stay still for long periods. Thirdly, MRI has contraindications with metal implants such as pacemakers, cochlear implants, or certain surgical clips. The strong magnetic field can interfere with these devices and pose serious safety risks. In addition, the narrow bore and loud noises during scanning can also cause claustrophobia and discomfort. Some patients may feel anxious or stressed during the procedure, which can make it difficult to complete the full scan of MRI. Lastly, MRI is very sensitive to patient movement. Even slight movements can blur the images, reducing the quality and sometimes requiring repeat scans. Overall, while MRI provides excellent imaging, these limitations should be considered to ensure the patient safety, comfort, and also efficiency and use of resources.